Hi, my name is Courtney and I'm a new mom to baby Ava. Um, Baby Ava was born at 34 weeks, so she's what they call a late preterm baby. A preterm baby is any baby born before the end of 37 weeks. Anyways, the reason why she was preterm was because I had something called severe preeclampsia during my pregnancy, and it means I had really, really high blood pressure combined with a couple other things. And the only cure for it was delivery of Ava, so it was a little unsafe for her and I at the end, so they had to get her out a little early. Um, Anyways, I knew that I would want to breastfeed Ava when she came, and I really wanted to even more when she was preterm, because my doctor let me know that my preterm milk for her is a little different than if it would have been term. My preterm milk contains more fat, more calories, more proteins, everything that she needs because she's so early, and it will also help prevent infection, which she's really at risk for because of being preterm. However, I was really, really worried about breastfeeding, mainly because I have inverted nipples. So my nipples actually point inward versus pointing out. And when she came early, that made me even more worried about breastfeeding. Anyways, I just wanted to make a little blog video for moms out there like me, just to show them that you can really overcome challenges, and that you're able to breastfeed when you have challenges like having a premature baby or having inverted nipples. Anyways, so I'll start talking about my first challenge, and that would be my inverted nipples. So basically, my nipples have been inverted for as long as I can remember. Um, and I never really thought that they were different, or would be a worry until I started researching in my pregnancy. Um, so I wasn't too sure I'd be able to breastfeed Ava, just because I didn't know if she would be able to latch, or yeah, how would that go? So I started talking to my doctor, and she said that breast and nipples come in all shapes and sizes, and very rarely are there shapes and sizes that are unsuitable for breastfeeding. And she reassured me that 10% of breastfeeding moms do actually have inverted nipples. So it made me feel a little bit better. And she let me know that there are many different types of inverted nipples. So there's something called true eversion, which luckily I don't have, which means that when you compress the areola of the nipple actually retracts back in and doesn't respond to any stimulation to come out. So I was very thankful that I didn't have that. She also worked with me throughout my pregnancy, giving me many different tips to help bring my nipples from innies to outies. So first we use cold compresses to help erect my nipples out. Secondly, she recommended using manual stimulation just by rolling the nipple. And third was something called the Hoffman technique, where you place both of your thumbs at the base of your nipple, and basically you just pull them away from each other. So you'll do it from side to side, top to bottom, and I did that about 5 times a day, and it did help bring my nipples out. My doctor also reassured me that sometimes your baby's suck reflex is enough to bring that nipple out on its own. So when baby Ava came early, I was so worried. I had really great perinatal nurses though, and they assured me that with some hard work and some patience, we'd be able to breastfeed. There were definitely a lot of challenges though, and it started as soon as she was born. So as soon as she was born, she was whisked away to the neonatal intensive care unit. She needed a little bit of extra care and support from the doctors and the nurses there. And so this meant that we didn't get initial skin to skin as soon as she was born. And I knew that skin to skin was so important for breastfeeding. It reduces your baby's stress, and it increases all the hormones that promote lactation, so it's just so vital. And also because she went to the NICU, we didn't get to initiate feeding within the first hour after birth. And so I was pretty upset about this, but my nurse assured me that it's still so important to do skin to skin whenever possible in the NICU, and baby Ava and I would still get all the benefits. So that really made me feel better. And also because Ava was born so early, she was so sleepy. She just had no energy stores, and so therefore she couldn't really let me know when she was ready to eat. She just slept all the time, and that really limited our opportunities to breastfeed. And normally babes will give mamas cues that they're ready to eat. So they'll bring their hands to their mouth, they'll root around for the breast, they'll open their mouths, but she just wasn't able to do it early on. And the nurse explained to me also that babies have different states of arousal. So the optimum state to feed your baby in is quiet alert, kind of what Ava is in right now. But she was having trouble regulating these states just because she was so premature and she just slept all of the time. Also, because Ava was born so early, she hadn't had time to develop her suck, swallow, breathe reflex, which is vital, and she just needed a little bit more time to work on it. So the combination of my inverted nipples and Ava being so premature made it very difficult to breastfeed. However, I had a great support system, and I turned to so many people for help. And one of my favorite people that I met was the lactation consultant, and I met her in the hospital as soon as pretty much the same day that I had delivered Ava. And she explained to me that there were 3 priorities when it came to breastfeeding my baby Ava. So, number 1, feed the baby. So with the help of the lactation consultant, because I wasn't able to breastfeed Ava right away, what she had me do was start manually expressing colostrum. And so I did it with my hands, and what I would do was I would manually express into a little tiny cup, and then what we would do is we would take a syringe and we'd go to the NICU, and we would feed baby Ava using a cup and syringe. And I was worried because it was such a tiny amount of colostrum that I was producing, but they ensured me that that small amount was everything that she needed in the first few days. They called it liquid gold. And so yeah, so I was happy with that. She was at least getting my breast milk. And then number 2 priority is to move the milk. So what I need to do is really work on stimulating my breast tissue to bring in and maintain my milk supply, since Ava wasn't there doing it for me. So I did this through a combination of hand expressing and also by using a breast pump. So I started off with just a manual breast pump, and I found that the combination of the hand expressing and using the pump really brought in my milk supply. I started producing a lot of milk by day 3 and 4, and it also helped, the breast pump also helped to bring out my nipples. So I was really happy about that. And then priority number 3 is support the mom and the babe in learning how to breastfeed. So I felt that the lactation consultant really taught me some great things. She taught me how to determine when Ava's ready to feed. So she taught me her sleep-wake cycles and her sucking patterns and cues that she'll cue me on, letting me know that she's ready to feed. And then she really encouraged me and supported me in early expression and pumping to help me bring in and maintain my milk supply. So that made me really happy. And she made sure that I was visiting Ava in the NICU for lots of skin-to-skin time and to help with her feeds. And so giving Ava the feeds of expressed breast milk with the syringe was really great for me. And after time, when Ava was a little bit more ready, she started showing signs of readiness to breastfeed, and she was in the quiet alert state, and so we decided that it was time to transition her to the breast. And so to help with her latch, I would use my breast pump to kind of help bring out my nipple a little bit more, and then she would be able to get an effective latch on to my boob. So it was very satisfying for me. I felt really great about it. And I mean, like all moms, when you're breastfeeding, you're concerned, is my baby getting enough? And I was really concerned about that, but the lactation consultant told me that I would know that my breastfeeding was effective based on Ava and what she was showing me. So first of all, she was feeding at least 8 times in 24 hours and at least once through the night. So that made me happy. And I made sure that she was latching well, and I could hear audible swallows, so I knew it was working. And I also monitored her wet and dirty diapers to make sure that there was an adequate number for the amount of days old she was. And then also, you know that your baby's getting enough when they're content after a feed. And she was gaining weight, so I was really happy. Things were working out well. So for all the mothers out there with inverted nipples and a premature baby, you can breastfeed. And I want to leave you with some advice. Have faith in yourself. Work on those nipples throughout your pregnancy using the Hoffman technique. That really worked for me. Have patience. It's going to take longer for you to learn how to breastfeed with your premature baby. And remember the 3 priorities. Feed your baby, move the milk, and get support for you and your baby. These priorities can be achieved through lots of skin to skin, and get that breast pump, whether it's manual or electric. It really helped bring in my milk, and it really helped bring out my nipple if your preemie can't get to the breast or has an ineffective suck. And if feed your baby with express breast milk, you're still giving your baby your liquid gold, and it's protecting them and it's feeding them. And once they show signs of readiness to come to the boob, start breastfeeding, and you'll know it's a success when you just watch your babe. Watch for their contentment and when they're gaining weight and what's coming out. And breastfeeding is possible even when you have challenges. So yeah, thank you.